to the fact that we are in the red when it comes to making progress on TB. Unfortunately, for the first time, thanks to COVID and conflict and other crises, we've seen a number of TB cases rise. So it's time to ramp up our efforts. It's time to end TB everywhere, because TB anywhere is TB everywhere. And it's especially important that we fight to ensure that people affected by TB have hope and solutions now more than ever. So with that, I am going to turn it over to some special guests who are here today to join us in this commitment to global TB action. First, it's my very deep pleasure to welcome Dr. Luchika Ditu, the Executive Director of the Stop TB Partnership, who is going to share a few words with us. Luchika?
Thank you. Thank you. Thank you so much. It's an honor, it's a privilege to be here, but I feel like at home, even though it's many kilometers till our home. Thank you to, first of all, I want to thank to the volunteers of the Results Canada, to the mothers and fathers and friends that came here to be with us. This is amazing. And I want to thank the team of Chris and Robin and the Stop TB Canada and everyone that made this event possible. And I want to thank Honorable Minister, but also our friends Joshua and Pierre and Nasir from the GAC for the continuous support and presence with us. So 3 things for all of us. First of all, it's a bit cold, but much better than I thought. No. First point that I want to make is we are a very ambitious community, and we put a lot of our efforts towards ending TB. We are not in a great spot because indeed COVID pushed us back. It's not that we were on an amazing path anyway, because ambition is there. We actually know what to do, but we never had enough resources to end TB. And year after year, the money that go into the TB programs represent 30 to 40% of what is needed. And therefore we try to operate 100% with a budget which is just 30%. This morning I was speaking with some French parliamentarians, and I was saying, it's like you try to go from Montreal to Ottawa, and you rather than fill in the tank, you just put 30% of the fuel and say, well, I will still arrive somehow. And year after year, you don't arrive somehow. And it's time now to say, well, we don't have the enough money that are needed. And the fact that we don't have the money is not that we need the money to have them. It's translated into a lot of people that die. 700 children a day die because of TB, 4,100 adults. It's incomprehensible. And also, very dramatically, of the people that get diagnosed with TB, 1 in 3 only is diagnosed with a tool that is recent and is recommended by WHO. 2 in 3 people diagnosed are diagnosed clinically or using a smear microscopy. There is no other disease in which you go and the doctor is like, okay, show me your urine, no test, just show it to me. Okay, I think you have a urinary infection. There is nowhere that you can do that, right? So I don't think we should accept it for TB. So that was my first point. It's time to speak up for this. The second point is I want to really thank Canada and our friends here for the continuous support to TB. And I know it's not easy because you have so much on your plates, so many competing priorities. But Canada was involved in the TB fight from the beginning, from the year 2000. Global Drug Facility was supported by Canada. TB Reach, which is the only structure that I am aware on the public health, in which you have an opportunity to be innovative. You give wings to the people on the ground to find solutions that are good for them, to find people, is a Canadian initiative. We bring now new donors, but it's a Canadian initiative. Canada is a huge donor to the Global Fund as well. I'm sorry for the Global Fund people looking at me, but Global Fund can do much better on TB, my friends, because from the money that are given, you give $5, only 1 goes to TB, okay? Out of that, there is a lot more going to HIV and malaria. It's a reality. So we need to work on that somehow. But irrespective of this, I know and I feel the pain of you guys having to handle all these requests. And my plea is, please don't give up on us, because we know what to do, and look what amazing community we are. The third point that I want to tell is this. We are living horrible times. COVID, 2 years, Who would have think we will be in that situation with COVID? And now we face a war. I know you are kind of far away, but it's actually having implications on all of us. And I don't think any of us, in our worst nightmares, would have think that we will have bombing and killing innocent people and hospitals and mothers and pregnant women. We have to stop this war, as we have to stop TB, and we know that we can do it. And I'm very grateful that we are here today, because only united we can fight this disease, and only united we can end it. And we need to invest some money for that, but we will do it, and we don't give up. And thank you very much.
Thank you, Luchika. As always, a powerhouse. And now it's a great privilege, and we're so thrilled that he's here today to introduce the Minister of International Development, Harjit Sajjan.
Thank you very much, and thank you for all the passion that all of you have shown this morning. But before I begin, I want to acknowledge that I'm speaking to you from the traditional unceded territory of the Algonquin and Anishinaabe people. And I'm here with our partners to highlight the importance of World TB Day. And you can just hear their passion that they talk when it comes to ending TB. And this Ottawa sign right behind us has been lit up in red to recognize this. And this is one of the nearly 44 landmarks and monuments across Canada being used to draw attention to the impact that tuberculosis has around the world. And as the previous speaker has stated, the COVID-19 pandemic infections, before the COVID pandemic, infections from tuberculosis was actually declining. And now these gains are being reversed. So as we continue to deal with the secondary impacts of COVID-19, we are seeing the number of deaths caused by TB going back up across the world. And also with Russia's illegal invasion of Ukraine, I'm very concerned about the devastating impact this might have on controlling TB in Eastern Europe and undoing a decade of progress. So far too many people are infected with and die from TB every single day. In 2020 alone, 20 million people fell ill with TB, including 1.2 million children. And too many of those who get TB die from it. And like so many other diseases, the most vulnerable bear the burden of TB, especially poor and marginalized women and children. It remains one of the top 5 killers of adult women in lower income countries. In 2020, 3.3 million women around the world contracted TB, and more than 500,000 women who were infected died from this disease. A disease that we can do something about, a disease that can be eliminated. And TB Reach is working to revolutionize the diagnosis and treatment of people with tuberculosis. To reach more people vulnerable to the disease and to treat more those who have contracted it. And we have way more to do to end TB by 2030 in 8 short years that we have. So how are we going to get there? We will be investing in treatments and prevention, and by supporting organizations that are committed to ending this. It is why Canada is the second largest donor country funder of global TB programming, and we'll continue to support efforts to reduce TB. Our support since 2010 has led to 2.5 million people having the disease detected and successfully treated. And this work has helped prevent more than 13 million new infections as well. But we need to do more, which is why today I'm announcing a contribution of $11 million to Stop TB Partnership TB Reach program. So this support will help shine a light on the most vulnerable, such as women and girls, people living with HIV and AIDS, migrants and disadvantaged groups. And we will find new ways of reaching those in need so that they can get care and treatment they need for this life-threatening disease. This support will also help integrate services for TB and COVID-19 and strengthen integrated health services for the most vulnerable people around the world. So today on World TB Day, we acknowledge a disease that continues to infect and kill far too many people. But also I want to also acknowledge the incredible work of partners like TB Reach and Results Canada. Your tireless efforts to raise awareness and find solutions to give hope to people around the world. Thank you so much. Merci beaucoup.
Thank you, Minister. That investment in TB Reach is going to have tremendous impact, so thank you so much. Finally, I'd like to introduce Dr. Suvesh, a physician who was previously the technical advisor for Nepal's TB program and is very familiar with the work of TB Reach. Please welcome to the podium.
Respected Honorable Minister Harjit, Luchika from Stop TV Partnership, Chris from Results Canada, Stop TV Canada colleagues, and everyone presented here. First of all, namaste and good morning. I'm Suvesh. I'm from Nepal, and I worked with National TV program for the last 7 years. So TB is still one of the leading cause of death in Nepal, and TB is one of the priority program of Nepal as well. So TB program is being supported by lots of partners, which includes Stop TV Canada, Stop TV Partnership, Global Fund, WHO, Damien Foundation, and we started receiving the TB Reach grant from 2009. So today I want to highlight few of the achievements that National TB program has achieved due to the TB Reach grant. So first major achievement that we achieved is the diagnostic part, where TB Reach supported to roll out the GeneXpert in 2011 for the first time. And stepping on this initiative, we have now a huge GeneXpert network, and it is being used as a primary tool of diagnosis in Nepal. TB Reach has always supported Nepal to increase the case notification, in vulnerable as well as hard to reach population, with the support of local organizations like BNMT, Jantra, and empowering the local community. TB Reach has also supported us to involve private sector in management as well as notification of TB cases. And recently TB Reach is supporting Nepal to introduce artificial intelligence to detect TB. So in a nutshell, TB Reach is supporting Nepal to increase case notification, to enroll the people in treatment early, and to find the innovative way to diagnose the TB cases in vulnerable and hard to reach population. And these impacts are not only in Nepal, but it can be translated to all the countries that TB Reach is working. So I would like to thank TB Reach for all their good work. And I would also like to extend my thank you to Government of Canada for being a foundational donor of TB Reach. But saying so, there are still huge number of cases being missed in Nepal. Almost 60% of cases are not being diagnosed. The disease, which is preventable and curable, is still killing 44 Nepalese a day, more than COVID-19 infection. Almost half of the Nepalese are infected with TB, but the coverage of preventive treatment is very minimal. We are still using the vaccine that was developed 100 years back, and the investment is very less, and TB people are bearing a huge catastrophic cost. And this is the situation of all the low and middle income countries with high burden of tuberculosis. So through this, today I want to request, and I'm thankful to Canada government that they are investing more on tuberculosis. Still more needs to be done because TB is killing people. And more investment needs to be done to find a new vaccine, to find more coverage of novel preventive treatment, and to find the missing million so that we can end TB. So I would like to say that let us all unite together to increase investment in tuberculosis and save lives and end TB. Thank you very much.
Thank you, Dr. Suvesh. There is so much more to do. You know, the road to ending TB is a long one, but we'll only get there if we take the steps. And today we took a big step. So thank you, Minister. Thank you, Luchika. Thank you, Dr. Suvesh. Thank you to all of you for being here. Thank you to Results volunteers from the bottom of my heart for inspiring us by working hard to light up those 44 monuments to shine a spotlight on TB. Let's work together to end this curable, treatable disease forever. Thank you very much, everybody. And let's just gather for one more photo, please.
Yeah, grab your signs.
Grab your signs.
I was like, these fingers must be. Stop to be Carter Jet. Is Stop to be Canada? Anyone from Stop to be Canada here? What's that? Here, Josh, you guys want to get in? Yes, Josh. Come on! Let me see your luggage. Yeah, I gotta put a plug in there. Oh, sorry, why was sick? Nice to meet you. Yeah. I saw you on Instagram. Had to do like a split second move.
Good job, Laura.
I don't think there's don't grip anymore. Great job. Great pivoting.
Is it? Do I have mascara everywhere?
No, do I? Probably.
A little bit on the
It's always on the right. At least I know where it is usually now. Oh no, top. Sorry. Isn't clear. Yeah, it's because I was like, this is not. Thanks for coming.